Welcome to Chapter 56, Coordinating Care for Patients with Oral and Esophageal Disorders for NCLEX Success Practice Quiz. This video will help you to master the NCLEX subcategories and the way the NCLEX is tested. Join me on the upper GI disorder chapter to figure out the psychology of the NCLEX using this chapter 56 from Davis Advantage Medical Surgical.
Hi friends, I'm Nurse Mia. Welcome back to my channel and to part 3 of the Med-Surg RN chapter NCLEX review in the GetsZen RN study group series. In this video, we are breaking down the 15 NCLEX clinical judgment domains and showing exactly how they connect to the Med-Surg chapter you are already studying. We will walk through each one step by step so you can finally see how NCLEX thinks and how to answer them. If you are being overwhelmed and unsure what the NCLEX really wants from you, this might be the missing piece.
So as we know, the NCLEX is broken into 15 specific area. Here we have a candidate that did not pass the NCLEX and says it's my second fail. Here there are the 15. We have the management of care and psychosocial adaptation plus the 6 clinical judgment, which is huge focus of the new exam. By focusing our notes around those 15 domains, we can learn how it places them into correct context for the exam. For making a connection to clinical judgment, it's like recognizing the cues, what clinical manifestation are observed in this patient, for instance. For analyzing cues, how do the clinical manifestation correlate to the underlying pathophysiology? Prioritizing hypotheses, what could happen if the patient's symptoms are not effectively managed. Generating solution, what treatments are included to manage the patient condition. Taking action, what are the patient priority intervention for this patient. And evaluating outcome, what findings demonstrate that the patient treatment plan is effective. What follow-up data are needed. And I have 15 questions per each of them, and also I have question number 16 where I can combine two domains in one questions because some questions in NCLEX that they are tested. And here you see the pie. Imagine if you aim for 100 questions. Imagine basic care and comfort, it's 9%. So that means around 9 questions will pop up if it's 100 questions. If it's less, then imagine the first 3, if you don't pass the question in that mix of questions, then will show the candidate that it's below. That doesn't mean that that person doesn't know basic care and comfort. It's just because it's give the candidate a limited questions in order to pass or not to pass. So even if give you from harder to lower, you need to kind of back up like twice in order to be always above that green light. So if you miss one hard, then they give you another one and then another one. If you pass these 2, then you are above the line. and then they give you again harder, and if you don't, then give you another 2 more chances, and on the second easy chance you missed, then again it shows you below or maybe near. And let's see, I will have the practice the way I go domain by domain, and then I take the summary of the chapter and I will make a table like what could be in each of them from the chapter and diseases, and then will be questions. So that is going to be the agenda for this part 3. This is the concept map from my outline video, coordinated care for patients with oral and esophageal disorders, the chapter 56 from Davis Advantage. In here we have like all the diseases. The outline is really kind of long because we have all those with AP, patho, labs, diagnostics, treatment, nursing intervention, pictures. So that makes it very long per each, and then times this. This is a long chapter. The next 57, it's not that long, but still a lot of detail in that chapter as well. And then the 58, it's huge. That is huge. 59, it's so-so. 60, it's so-so. But yeah, 58, it's huge. It's longer than this one. I'm trying to take it shorter. So chapter 56, it's the oral cavity and esophagus are integral parts of the gastrointestinal, the GI system, responsible for mechanical and chemical breakdown of food, speech, swallowing, and initial digestion. The oral cavity and esophagus play critical roles in digestion, speech, and overall quality of life. Disorders affecting those structures can impair nutrition, communication, and social functioning. Conditions range from benign inflammation to life-threatening cancers or trauma. Nurses are essential in early recognition, patient education, acute management, and long-term care. Disorders in those areas can impair nutrition, airway patency, and quality of life. This chapter covers common oral and esophageal disorders. Their pathophysiology, diagnostic, evaluation, management, and nursing care. The oral cavity is the gateway to the digestive system, responsible for mechanical breakdown of food, speech, breathing, and sensory functions such as taste. Its mucosal lining is delicate and prone to injury or infection, impacting not only digestion but also quality of life and social interaction. So the next slide will gonna be like just a quick summary. The oral and esophageal disorders, chapter 56, we start with stomatitis. Is characterized by painful inflammation and laceration of the oral mucosa, increasing vulnerability to infection. Cause includes infection, pathogen, medication, chemo, and radiation, mechanical irritation, nutrient deficiencies, systemic disease, and allergic reaction. Management emphasize meticulous oral hygiene, adequate nutrition, and target treatment of this underlying cause to minimize severity and prevent complication. The hiatal hernia, there are two types, occurs when the gastroesophageal junction weakens. The two primary types are sliding hernias and the paraesophageal, the rolling hernia, the type 2. Sliding hernias are most common and may be asymptomatic or present with symptoms of GERD. Large paraesophageal hernias can lead to severe complications such as volvulus incarceration or strangulation. Management ranges from medical therapy for reflux to surgical repair in refractory or high causes. The GERD management includes antacids, H2 receptor antagonists, proton pump inhibitors, and prokinetic agents combined with lifestyle intervention like weight management and avoiding the lower esophageal sphincter lowering foods. The oral cancer, primarily is squamous cell carcinoma, is strongly linked to alcohol, tobacco use, and poor oral hygiene. It often presents late, leading to reduced survival rates. Prognosis is influenced by tumor size, location, APV status, HPV status, and the metastatic stage like TNM classification. Treatment can involve surgery, radiation, and chemotherapy with significant functional and quality of life impacts. The oral trauma can compromise the airway due to swallowing and bleeding, making airway stabilization the priority. Once stabilized, surgical repair can end infection. Prevention follow. Nutritional support and close airway monitoring are critical during recovery. Esophageal cancer, often asymptomatic until advanced, has a poor prognosis. Types include the SCCA, usually in the upper middle esophagus, and adenocarcinoma, typically at the GHD, GEJ, the junction, and the link to GERD. Those cancer impair swallowing and nutritional status. Treatments include surgery, chemotherapy, radiation, and minimally invasive endoscopic option. Lastly, we have the esophageal trauma. This disrupts swallowing and nutritional intake. It can be accidental or intentional. Complications include perforation, shock, can be shock, hemorrhage, and death. Outcome depend on early detection, the cause, and infection control. Management often involves surgical and endoscopic intervention and aggressive supportive care. And that's it for a little brief summary. I made a tiny little table where we have the NCLEX candidate report performance with all the domains, the classic one and the here the other ones. Here is the new ones. This is the original ones from the pie. So basic care and comfort, if it's 9%, which is like very few questions, provide soft, moist food, manage pain before meals, or offer frequent mouth rinses. So this I said a lot in nursing intervention for all the diseases in outline. And the red flag is that serving dry, spicy food to oral lesion patient. In the book says that avoid. So if you serve, that means it's a red flag, it's minus. So salty water or baking soda is for stomatitis. So that is for the basic care and comfort. So analyze the cues. We have to interpret the link between symptoms and disorders like GERD, Barrett risk, the hernia, reflex, stomatitis, to nutrition deficits. So that, and then the red flag is that attributing chest pain, so lay to cardiac without ruling out GI causes or vice versa. To remember, it's Barrett precancerous, paraesophageal hernia risk, it's strangulation. So for recognizing cues, we have identify key assessment, finding oral pain, dysphagia, odinophagia, weight loss, GERD symptoms, oral lesion, regurgitation, hematitis. I'm gonna take the light zone out, and maybe you can, where is it? So you can take a short screen. So the red flags for recognizing keys is missing the silent symptoms of cancer until late stages, overlooking subtle weight loss or early dysphagia. So keep in mind alarm symptoms for dysphagia, odinophagia, hematemesis. It's like more than 5% weight loss in a month. Keep that in mind. And then we go to the next slide. Here we have our pie, the original pie. Here is like what to watch for, what the item asks you to do, and classic pitfall to avoid. Let's go to basic care and comfort. Pain management for stomatitis, positioning for reflux, nutrition support for dysphagia. What they might ask you is just to choose intervention that promote comfort and promote healing. So giving acidic or spicy food in stomatitis, ignoring upright positioning while eating, and what else? The bed of head elevated. Which disease stays on the right side, and sort of this. Which disease I talked in outline for high protein, and after what surgery you need to give soft meals. What you do is the clutters, the clutters to cut the wires. What else? Yeah, so those things, they are like basic care and comfort. The meds, I think everybody knows that the GI, it's PPIs, H2 blockers, anti-acidic. Keep in mind to tell patient like after nutritional, like some medication they have like before, after, in the night, 30 minutes, 1 hour, 2 hours before you sleep, you eat. So search those things. You can make a flashcard on your own word and um, you can remember that. Um, Aspiration, like for safety and control, aspiration for dysphagia, and also keep in mind with oral lesions. So now we go next. We have more. We have another table similar like this. Now we are in questions. Stomatitis, domain, basic care and comfort. Which nursing intervention are appropriate for a hospitalized adult with chemotherapy-induced stomatitis? Select all the apply. And it's basic care and comfort, right? So what is the correct answer? Provide frequent saline mouth rinses. Offer lemon flavored swab. Um, think what I said during stomatitis. So it's exactly from nursing intervention in the patient teaching, this section. Avoid spicy and acidic foods. Encourage use of alcohol-based mouthwash. Monitor for signs of oral candidiasis. Prevent fragrant saline mouth rinses, correct? Avoid spicy and acidic foods, correct? And monitor for signs of oral candidiasis. Why? Because the saline rinses smooth mucosa. Avoiding spicy acid foods prevent irritation. Monitoring for candidiasis is essential due to immunosuppression. Lemon swab and alcohol mouthwash worsen irritation. Question 2, hiatal hernia, domain, health promotion and maintenance. An adult with a newly diagnosed sliding, so this is sliding, hiatal hernia, ask how to prevent worsening symptoms. Which patient statement indicates the correct understanding? I will avoid lying down for at least 2 hours after eating. I should eat 3 large meals a day. I can drink peppermint tea after meals to help digestion. I will increase my intake of fatty foods for calorie. Correct answer is I will avoid lying down for at least 2 hours after eating because remaining upright after meals decreases reflux. Large meals, peppermint and fatty foods worsen the lower esophageal sphincter relaxation and symptoms. Next. Question 3, GERD, domain of pharmacological and parental therapies. Which instruction should a nurse give a patient prescribed omeprazole for GERD? Take the medication with with the largest meal of the day. Take the medication first thing in the morning before eating. Crush and mix the medication with applesauce. Stop the medication when symptoms resolve. Correct answer is take the medication first thing in the morning before eating because the PPIs like omeprazole should be taken before meals, preferably in the morning. To inhibit acid production, they should not be crushed or stopped abruptly without provider advice. Question 4. Oral cancer, domain management of care. A patient is recovering from surgical resection of oral squamous cell carcinoma. Which nursing action takes priority? Encourage oral fluids, assess airway patency, provide oral care every 8 hours, initiate enteral feeding immediately. Correct answer is assess airway patencies, ABC. Airway assessment is the highest priority in immediate post-op care. Oral fluid and filling are initiated on feeding, not filling. Oral fluids and feeding are initiated only after swallowing safety is confirmed. Question 5 is esophageal cancer, domain physiological adaptation. Which symptom in a patient with esophageal cancer requires immediate intervention? Progressive dysphagia, hoarseness, sudden severe chest pain, weight loss over 3 months. Correct answer is sudden severe chest pain. Because can indicate esophageal perforation, a medical emergency. Progressive dysphagia, hoarseness, and weight loss are expected but not emergent. Question 6. Esophageal trauma, domain safety and infection control. A patient with a blunt chest trauma is suspected to have an esophageal injury. Which nursing action is the priority? A. Prepare for emergency endoscopy. B. Insert a nasogastric tube. C. Provide oral fluids for hydration. D. Position the patient flat to rest. Correct answer is prepare for emergency endoscopy. Because early diagnosis via endoscopy is essential to prevent complication. NG tube insertion is avoided until injury is ruled out, and oral intake is contraindicated. Question 7. Stomatitis, domain, reduction of risk potential. Which finding in a patient with stomatitis warrants immediate provider notification? A. White coating on the tongue. B. Oral pain rated 8 from 10. C. Inability to swallow liquids. D. Reddened oral mucosa. Correct answer is inability to swallow liquids, because liquids increase risk for aspiration and dehydration and requires urgent intervention. Question 8. Hiatal hernia, domain, basic care and comfort. Which position should the nurse recommend to an adult with a paraesophageal hernia to minimize symptoms? Supine with head elevated, high failure after meals, left lateral recum bent during sleep, Trendelenburg position. Correct answer is high failure after meals, because reduces reflux and prevents hernia related discomfort. Question 9. GERD, domain, health promotion and maintenance. Which patient statement about GERD management indicates a need for further teaching? A. I will avoid coffee and chocolate. No, I won't. Joking. Oh, my coffee. B, I can't have a glass of wine with dinner. C, I will lose weight if advised by my provider. D, I will elevate the head of my bed. So this question says need further teaching. So what was incorrect? I can have a glass of wine with dinner because alcohol can relax the lower esophageal sphincter and worsen GERD symptoms. Question 10, oral cancer domain, psychosocial integrity. A patient post-oral cancer surgery expresses embarrassment about altered speech. Which response by the nurse is most therapeutic? A. Your speech will be normal soon. B. You shouldn't feel embarrassed. It's not noticeable. C. Tell me more about how this is affecting you. D. Let's practice speaking now to improve it. So, which response by the nurse is most therapeutic? Tell me more about how this is affecting you. Encouraging the patient to share feeling promotes emotional support. Minimizing or making assumption is not therapeutic. Question 11. Oral trauma jaw wiring, domain safety and infection control. A patient with a mandibular fracture has undergone a surgical procedure for fixed occlusion, wire jaw. Which safety intervention should the nurse include in the plan of care? Select all of the apply. A. Keep wire cutters with the patient at all times. Elevate the head of bed 30 to 45 degrees. Instruct the patient to cut wire immediately if they experience respiratory distress. Implement aspiration precaution and keep suction equipment available. E. Advise the patient to lie flat, supine while sleeping to stabilize the jaw. Correct answer is keep wire cutters with the patient at all times. Elevate the head of bed 30 to 45 degrees. Instruct the patient to cut wires immediately if they experience respiratory distress. And implement aspiration precaution to keep suction equipment available. And A and C is correct because the text exactly says wire cutters are required to be available with the patient at all times. So the mouth can be opened to clear the airway or perform life-saving maneuvers. Patient families are taught to cut wires in emergencies. B and D are correct because the elevating head of bed, it decreases the risk of aspiration, and then the patient with wired jaw are at risk for airway compromise from saliva and vomiting. So E is incorrect because laying flat increases the risk of aspiration. So the patient should be elevated. Question 12. Esophageal cancer domain, health promotion and maintenance. A nurse is developing a teaching plan for patient at risk for esophageal cancer. Which modifiable risk factor should the nurse emphasize to help the patient reduce their risk? Select all the apply. Obesity, tobacco use, heavy alcohol consumption, GERD, age of 50. Correct answer are obesity, tobacco use, heavy alcohol consumption, GERD. So these are A is correct because obesity is known factor often associated with hernias and GERD. B and C, it's correct because the text says the risk of developing esophageal cancer increases 18 times for those who drink heavily, and smokers are 2 to 6 times more likely to develop it. Combined use increases risk 44 times. D is correct because chronic severe GERD increases the likelihood of developing esophageal adenocarcinoma by at least 43 times. So the next question. Question 13. We are the GERD. Domain, basic care and comfort, clinical judgment, take actions. The nurse is developing plan of care for a client newly diagnosed with GERD who reports frequent heartburn and regurgitation, especially at night. Which intervention should the nurse implement to manage symptoms and prevent complications? Select all the apply. Instruct the client to eat 4 to 6 meals per day instead of 3 large ones. B. Encourage the client to lay down immediately after eating to promote relaxation. C. Elevate the head of bed 6 to 12 inches using blocks or a wedge. D. Advise the client to lay on their right side while sleeping. E. Offer a snack of peppermint or chocolate before bedtime to smooth the stomach. Correct answer are: instruct the client to eat 4 to 6 meals per day. Elevate the head of bed 6 to 12 inches. And advise the client to lay on their right side while sleeping. So they are correct because the clinical judgment, take action, his focuses on implementing intervention to assess the prioritized hypothesis. In this case, reducing gastric pressure and promoting emptying. So the option A, eating 4 to 6 meals per day, is a critical action because large meals increase pressure in the stomach and delay gastric emptying, which contributes to reflux. Option D, positioning the client on the right side, is a therapeutic action that promotes gastric emptying and allow gravity to help move stomach contents into the duodenum, reducing nightmare reflux. So basic care and comfort focus on assistance with positioning and non-pharmacological symptoms management. So option C, elevating the head of bed, is a standard comfort measure that uses gravity to keep gastric contents in the stomach and return any refluxant from the esophagus back to stomach, preventing esophageal irritation while sleeping. So next. Question 14, esophageal cancer. We have post-op complication domain, physiological adaptation, clinical judgment, recognizing cues. A nurse is assessing a client who is a 3-day post-operative following an esophageal Esophageectomy with anastomosis for the treatment of esophageal cancer. With assessment findings should the nurse recognize as cues indicating a potential anastomotic leak require immediate intervention. Temperature 101.5, sustained tachycardia, respiratory rate of 26 beats per minute with short of breath, thick drainage with a full fall odor noted on the surgical dressing, small amount of seronegative drainage in the Jackson-Pratt drain. Correct answer are temperature, it's elevated, tachycardia, short of breath in 26 beats per minute, and thick drainage with a full odor noted on the surgical dressing. So those are the correct answers. Here is the rationales. So the recognizing cues focus on identify relevant and significant data that indicate a change in the client status. So option A, B, and C, the text explicitly states that the leakage from anastomosis sites where the esophagus is connected to the stomach allows gastric contents to spill into the mediastinum. This can produce clinical manifestation of early shock sepsis, especially listed in the text as fever, tachycardia, and tachypnea. Recognizing this triad of symptoms is critical for early intervention. Option D, the text box 56.1 instructs patients to seek emergency care for thick drainage that has a foul odor, as this indicates a deep infection or leakage of gastric contents rather than normal wound healing. So for physiological adaptation, which focus on management of illness and potential for complication, the nurse must understand that the pathophysiology of an anastomotic leak, which is a life-threatening complication leading to mediastinitis and sepsis. The cues identified in the correct option are the psychological response to this specific complication. So next question. Question 15, oral trauma, jaw wiring, domain reduction of risk potential and psychosocial integrity. A client arrives at the emergency department with a mandibular fracture and undergoes a surgical procedure for fixed occlusion with wired jaw. Which intervention should the nurse include in the post-operative plan of care? Select all of the apply. Keep wire cutters at the bedside at all times. Instruct the client to use a straw for all oral intake. Establish a method of communication, writing tablet, picture board, etc. Place the client in the supine position to prevent headache. Administer antiemetics prophylactically to prevent vomiting. Correct answer are: keep the wire cutters at the bedside at all times. Establish a method communication, writing tablet, picture board, and administer antiemetics prophylactically to prevent vomiting. So because the reduction of risk potential, it's option A and E. A and E. So the vomiting with a wired jaw is a life-threatening aspiration risk. So the wire cutters, it's at all times. And the psychosocial integrity, which focus on emotional, mental, and social well-being, it's this option C, because the client cannot open their mouth to speak clear, establishing an alternative communication method, so to reduce anxiety and frustration. This is the last question. Finally, we get to the end of this chapter, and also with part 3. So question 16, stomatitis, basic care and comfort, psychosocial adaptation. A nurse is caring for a client receiving chemotherapy who has developed severe grade 3 stomatitis. Which nursing actions are appropriate to promote comfort and healing? Select all of the apply. Encourage the use of hard bristle toothbrush to remove plaque. Administer viscous lidocaine as a squash and expectorate before meals. Provide frequent mouth rinses with saline or sodium bicarbonate solution. Offer foods that are hot in temperature to stimulate blood flow to the gums. I like this. Monitor the oral cavity for white patches. Thrush. Correct answer are administer viscous lidocaine as swish and expectorate before meals. Provide frequent mouth rinses and monitor oral cavity for white patches. So the rationale is that the option C, it's basic care because it's focused on non-pharmacological comfort and hygiene. So saline and sodium bicarbonate rinses remove loose particle and hydrate oral tissue and thin mucosa without irritating the inflamed mucosa. So for the psychosocial adaptation is option B and E. Focus on management, illness and complication. So, and this is the last question of this chapter, and we finish the chapter 56, coordinating care for patients with oral and esophageal disorder. So thank you for watching and being with me, and I will see you in the next chapter. Thank you for watching. Bye for now. Like and subscribe. Give me a comment. Bye.
We finally made it! Thank you again for your time and trust. I'm Mia, and from my heart to yours. Until next time, stay zen, stay grounded. Namaste. Bye for now.